Hello, welcome to another post from Dr. Blake's Healing Soul. Today, Aphrodite, our athletic trainer, here at the Center for Sports Medicine St. Francis Hospital, will introduce the concept of prolonged heat and ice stretching for chronically tight hamstring muscles.
Okay, so a lot of times we get patients that come in here that complain of a really tight muscle that they've had for a long period of time. So this method is really good to help stretch out that muscle. So in this video we're going to emphasize on the hamstrings. When the patient does this at home, you want to make sure that they have all the necessary equipment to do it. They're in a nice comfortable position. Seated is usually the best, but just make sure that the patient is nice and comfortable. There's a pillow supporting the back. I use a rolled up towel to support the knee. So go ahead and lift, relax. So you want the hamstring to be in a nice stretched position, but at the same time you don't want to hyperextend the knee. So you always want a little bit of support. Make sure that they have either a long towel or a belt at home that they can use that's long enough so that when you wrap it around the foot, they can hold it in a nice, comfortable position. If it's too strenuous for them to hold it for too long, you can use pillows underneath the elbows or arms to support a little bit more. So first we start off with heat, and the heat helps stretch out the area, the hamstrings in this case. So here we use a hydroculator pack. It gets pretty hot, so I make sure that there's always a layer between the skin and the hot pack to prevent burn for the patient. At home they can use, they have like hot and cold in one pack, so they can buy that at CVS, Walgreens, those places. And then I make sure that I put the heat directly underneath the hamstrings. So go ahead and lift. And then I take the towel or the belt, and I have the patient put it around the ball of their foot and have them hold it with their hands until they feel a nice good stretch in the hamstrings. So you don't want it to be painful, you want it to be comfortable enough so that they can hold it, if tolerable, for 10 minutes initially. And then we're going to go, after the 10 minutes is up, you want to switch with ice. So we use an ice pack here that's pretty flexible. But again, if they don't have access to this at home, they can use a bag of crushed ice, or like I mentioned, the pack where you can do heat and ice at the same time. So after that 10 minutes is up, again, if they can tolerate it, if they feel like they're not getting enough of a stretch after 10 minutes, you can progress in time. So typically we go up to 30 minutes if needed, and then you always go about half the time for the ice. So once that's up, make sure that the patient has someone else that can help out to remove the heat pack. So you want to maintain that stretch the whole time. And then you're going to replace the heat pack with the ice. Go ahead and relax. And making sure that the patient holds that stretch the entire time. And again, if you do the heat pack for 10 minutes, you're going to do the ice pack for 5 minutes. So the ice is kind of freezing the area of stretch to where the Golgi tendons relax in that position.
Great. Thank you very much, Aphrodite, for explaining those principles of prolonged heat and ice stretching for chronically tight hamstring.